Imagine two people. One smokes a pack of cigarettes every single day. The other one is perfectly healthy, no bad habits, no junk food, exercises regularly. But there's one thing missing from their life: friends, real connection, human warmth. According to science, the second person may actually be at greater risk of dying early. That sounds impossible, but it's true. And today we're going to find out why. We are in the middle of a loneliness epidemic, and almost nobody is talking about it seriously. In 2023, the United States Surgeon General released an official advisory calling loneliness a public health crisis. Not depression, not obesity. Loneliness. So what exactly is loneliness? Most people think it just means being alone, but that's not quite right. You can be surrounded by 1,000 people and feel completely, devastatingly alone. Loneliness is the gap between the social connection you have and the social connection you actually want. It's a feeling of being unseen, unheard, irrelevant. And that feeling, it turns out, is extraordinarily dangerous to your body. Let's start with the numbers. A landmark meta-analysis published by researcher Julianne Holt-Lundstad looked at data from over 3 million people across 148 studies. The conclusion was staggering. Social isolation increases the risk of early death by 29%. Loneliness increases it by 26%, and living alone increases it by 32%. Meanwhile, smoking about 15 cigarettes a day increases mortality risk by roughly 30%. They're in the same ballpark. Loneliness is as deadly as smoking. Let that sink in. But how? How does a feeling kill you? The answer starts in your brain. When your ancient ancestors lived on the African savanna, being separated from the tribe meant death. Lions, starvation, exposure. Your brain evolved to treat social isolation as a life-threatening emergency. And it still does. When you feel lonely, your brain activates the same threat detection systems as when you're in physical danger. Your amygdala, the brain's alarm system, goes into overdrive. Your body floods with cortisol, the stress hormone. And here's the thing about chronic stress. It doesn't just make you feel bad. It quietly destroys your body from the inside. Elevated cortisol over months and years suppresses your immune system, raises your blood pressure, inflames your arteries, and disrupts your sleep. Every single night. Researchers at UCLA found that lonely people have fundamentally different gene expression than connected people. Genes related to inflammation are turned up. Genes related to antiviral defense are turned down. Your body is literally rewired by loneliness at the molecular level. Think about that. Just feeling alone changes which of your genes are active. This is called the social genomics effect, and it means loneliness isn't just in your head, it's in your cells. Now let's talk about the brain. Neuroscientist John Cacioppo spent decades studying loneliness and made a discovery that should terrify all of us. Lonely people's brains are fundamentally different in how they process the world. When a lonely person sees a social threat, someone frowning, someone ignoring them, their threat detection system fires faster and louder than in non-lonely people. But here's the cruel twist. Loneliness also makes people more suspicious of others, more guarded, more likely to interpret neutral situations as hostile. So loneliness creates a feedback loop. You feel alone, so you become more defensive, so you push people away, so you feel more alone. Cacioppo called this the loneliness loop, and it's one of the main reasons loneliness is so hard to escape without intervention. Let's talk about sleep, because this is where loneliness gets really sinister. Studies show that lonely people sleep significantly worse than connected people. Not just less sleep, worse quality sleep, more micro-awakenings during the night, less deep, restorative sleep. Remember, your ancient brain thinks you're isolated from the tribe and therefore in danger, so it keeps one eye open, literally. It never lets you fully rest, and bad sleep cascades into everything. Worse mood, worse immune function, worse cognitive performance, higher risk of heart disease and diabetes. Loneliness doesn't just hurt you, it exhausts you. And then it hurts you more. Now let's zoom out and look at the scale of this problem, because this isn't just about a few shy people. This is a civilizational crisis. In the United States, over 50% of adults report measurable levels of loneliness. In the UK, it got so serious that the government appointed an actual minister for loneliness in 2018. Japan followed in 2021. A survey of Generation Z, people born after 1996, found that they are the loneliest generation ever recorded, despite being the most digitally connected generation in human history. And that's the paradox at the heart of our modern crisis. We have more ways to communicate than ever before, and we have never felt more alone. Social media promised us connection, but what it often delivers is comparison, performance, highlight reels. You scroll through other people's perfect lives and you feel worse about your own. You have 800 followers and 0 people to call at 2 a.m. when everything falls apart. Researchers distinguish between quantity of connections and quality of connections. And it turns out quality is almost everything. Having 3 deep, trusting, reciprocal friendships is far more protective than having 300 surface-level acquaintances. What your body needs isn't just the presence of other humans. It needs to feel that it matters to someone, that someone would notice if you disappeared, that you are known. Now let's talk about something called social pain. In 2003, researcher Naomi Eisenberger conducted a remarkable brain imaging study. Participants played a virtual ball-tossing game with what they thought were other players. Then, without warning, the other players stopped throwing the ball to them. They were socially excluded, and their brains lit up. Specifically, the dorsal anterior cingulate cortex, the same region that processes physical pain, activated in response to social rejection. Being left out, literally, hurts. The same way a broken bone hurts. This is why heartbreak feels physical, why grief feels like a wound in your chest, why loneliness is genuinely painful. Your brain doesn't distinguish between social pain and physical pain. They share the same neural hardware, and we treat them very differently. If you broke your leg, everyone would rally around you, they'd bring you soup, they'd check in. But if you're lonely, if you're in that same level of neurological pain, you're expected to just get over it, pull yourself together, go make friends, as if it were that simple. And this brings us to one of the most important questions: who is most at risk? The answer might surprise you. Yes, elderly people living alone are extremely vulnerable. But loneliness spikes at 2 other unexpected points in life: young adulthood, roughly ages 18 to 25, and middle age, around 45 to 55. Young adults are navigating new environments, losing old friend groups, building identity. Middle-aged adults are often buried in work and family obligations with no time for genuine friendship. The BBC Loneliness Experiment, the largest study of its kind with over 55,000 participants, confirmed this U-shaped curve. We are most lonely when we are young, least lonely in our 30s and 40s, and then lonely again as we age. And the consequences compound over time. Loneliness in your 20s plants seeds of inflammation, poor sleep, and stress that bloom into heart disease and dementia decades later. A study from Rush University Medical Center found that lonely people had a 64% increased risk of developing clinical dementia. 64%. Loneliness doesn't just make your life feel shorter, it makes your mind fade faster. So what do we do about this? Here's where the science gets genuinely hopeful. Because loneliness is not a life sentence. The brain is plastic. Connections can be rebuilt. The first thing researchers emphasize is that the goal isn't to become an extrovert. It's not about going to more parties or forcing small talk. It's about creating what psychologist Susan Pinker calls a personal village, a small circle of people who truly know you. And the research shows that face-to-face interaction is irreplaceable. Even brief in-person contact, a conversation with a neighbor, a coffee with a colleague, triggers neurochemical responses that digital communication simply cannot replicate. When you're physically near someone you trust, your brain releases oxytocin, the bonding hormone. Your heart rate synchronizes with theirs. Your nervous system calms. This is called co-regulation, and your body is designed to need it. There's also growing evidence that acts of giving, volunteering, helping others, contributing to community, reduce loneliness more effectively than receiving social attention. When you feel useful to someone, your brain interprets that as evidence that you matter. And mattering is the antidote to loneliness. Some cities are now redesigning public spaces specifically to encourage spontaneous human contact. Benches facing each other instead of away, community gardens, libraries with gathering spaces. Urban planners are starting to understand that the built environment shapes our social lives. And at the policy level, there are calls for loneliness to be treated with the same seriousness as smoking or obesity. Mandatory social prescribing. Community health workers who connect isolated individuals to groups and activities. Some doctors in the UK now literally prescribe social activities the way they prescribe medication, because that's what the evidence demands. Here's the philosophical point I want to leave you with. We live in a culture that glorifies independence, self-sufficiency, the lone wolf, the self-made person. We've built an entire mythology around not needing anyone. But the science tells a completely different story. You are not designed to be alone. Every cell in your body, every circuit in your brain, every gene in your DNA evolved in the context of community. Connection is not a luxury. It is not a personality preference. It is a biological necessity as fundamental as food, water, and air. The loneliest people are not weak. They are not antisocial. They are often people who have been failed by a world that forgot to build the conditions for belonging. And if you are lonely right now, if you are watching this and feeling that quiet ache of being unseen, I want you to know something. Your pain is real. It is neurological. It is physiological. It is not a character flaw. And you are not alone in feeling alone. The first step is simply naming it, because loneliness thrives in silence and shame. When we talk about it, we break its power. Reach out to one person today, not a text, a real conversation. It doesn't have to be perfect, it just has to be real. Because your life, literally, biologically, measurably, depends on it.